All right, everybody, we'll bring this Health and Human Services Committee meeting to order July 15th, 2025 at 3:45 p.m. And we will begin with Commissioner Gibson, DSS.
Hello.
Good afternoon.
I see everyone.
So that's what it's called.
So the first resolution is to abolish one account clerk position because it had been held open originally on a leave of absence, and that leave of absence is now behind us, and that person is permanent in a new job, and I do not believe we need this position.
Move it.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
All right, second resolution is to revise the salary for the county medical director's services to the department so that he can oversee our urine analysis tests whenever they are necessary.
Move it.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
All right, the third is an authorization to fill one social welfare examiner position.
I'll move that.
Do I have a second?
Second.
Further discussion? Looks like the movement's in-house though,
It is.
instead of leaving in a couple of positions, which is good.
Yep.
All in favor?
Aye.
Opposed? Carried.
Yeah, and one, the last is the, an authorization to fill the senior child support specialist.
I'll move it.
Do I have a second? Further discussion? All in favor?
Aye.
Opposed? Carried.
Of course, I'll take any questions you may have, otherwise, there's still a slight dip in the homeless numbers. The dip we'd like it to be.
What's the hiring market like these days?
The,
Hiring market.
I think it's still pretty good. We're a service community, so, but there's some labor jobs out there. We just had a client, a reentry client get a job, at ShopRite, which I was encouraged with. So, yeah, I think we're hiring stuff around here.
Thank you.
Any further questions for Commissioner Gibson? All right, there being none, we're going to move into the Health Department.
Thank you, sir.
Thank you.
Hello.
My first resolution is a request to purchase a new lead paint analyzer.
I'll move that.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried. Interesting that the pipeline for our isotopes are coming from Ukraine and Russia.
A little scary.
There's a great article on the evolution, the genetic evolution of dogs and wolves in the Ukraine, in Russia, based on the Chernobyl.
Chernobyl. Yeah, I read that.
Yeah, wasn't it interesting?
I read that too. It was quite interesting.
And that fallout made the dogs friendlier, I'm assuming?
No,
Not a good report.
not a good
Not a
report.
good report, no?
It can fly.
Yeah.
Yeah.
Or glow in the dark permanently.
Oh, that was my only resolution. So now I've got my director's report. If anybody has any questions, I will note that the tick-borne illness in June was
Big spike.
awful,
Yeah.
awful. A lot of hospitalizations, emergency department visits, startling.
And still, are we in danger of running out of doxycycline or any of those things locally?
Not yet.
Is there anything that you can do proactively for spraying for whatever? I mean, there's not a day that my dogs don't come in the house with ticks on them up in Australia. I mean,
Yeah.
For
this
me,
morning I'm sitting on my chair, one walking right here because he just went out. My wife had me today. I mean, they're everywhere.
Yeah.
So what works?
for me,
I know I have it, but I spray it. So.
Checking yourself, unfortunately, the environmental sprays are not necessarily encouraged on a large level. And, it's unfortunately our changing climate that encourage it. And, there's a cyclical, to their lifespan or, so certain years are worse than others. And I think it's kind of a combination of all those things that we're seeing now. I hope, hoping next year's a little bit better. Because you're absolutely right. They're everywhere.
I'm surprised there's not companies that are spraying for that.
I'm sure there are.
I know
How
that they're not easy to
good
find.
they are,
Right.
how,
you say
reliable
that-
they are.
They come at night.
Is a separate topic. There's
Well,
some,
I
you
mean,
can pay somebody to do that.
Remove the warning labels on their chemistry.
Well,
And,
my point
Yes.
is that, yes, I understand that the chemicals can be bad, but the effects of tick-borne disease are horrific.
Mhm.
I have friends that, one of their family members can't work, can't do anything. Like,
Absolutely.
so there has to be some common ground there. I'm not asking you, but I'm just saying, why don't we?
It's a great conversation to have because there's the, the impact of one person of being bitten by a tick and becoming very ill and, the devastating
Maybe
effects.
forever.
But absolutely, you're
Right.
absolutely correct. But then also the chemicals that they use to, spray lawns or spray people's homes can also lead to devastating effects. So maybe there's something better coming. I don't know what that is.
But are there
I
other
don't know.
studies on these sprays that they use outdoors, because I'm indoors, that, I have some that say it doesn't harm humans. I mean, I know you're saying that there's devastating effects, but are there real studies on those spraying 2 times in your yard or 4 times a season, that's gonna cause devastating?
So, and not necessarily devastating effects from spraying a lawn, but I'm talking about like at a population health
Right.
level.
Right.
Spraying a lawn, I think the biggest, comment on that is it doesn't
Doesn't
work.
last.
It doesn't last.
Yeah.
It's,
Get a rain right after it's
and
gone.
then it's gone. So,
and I can tell you a flock of ravenous chickens don't fully work
That's-
either.
yeah.
More possums, no possums.
I have them cross my lawn daily and still,
Or even the guinea pigs, yeah.
Don't possums eat a lot of them too?
They do.
Yeah.
Yeah,
Yeah.
I think possums are cute.
I encourage like.
Possums are the answer.
They are. They eat ticks. It's work.
unfortunately, they're the answer for
Safely
dogs
swerve if
looking
you
for
see-
sport
yeah.
as well. But
Yeah.
Right.
And
Right.
cars.
Yeah.
Unfortunately.
I'm a little late. Did we put this in notice out? Because I have like,
So we did put a notice out after we put together this report. It was the beginning of July and we were going into the holiday weekend.
right.
So we felt compelled to issue, a notice that there were, we're seeing a huge, startling uptick in tick-borne disease. So we did put something out. When we
Does the
were-
health department, supply doxy if someone
No,
needs it?
no, no,
So you have to go.
You
to
have
the
to go to your doctor.
Which is not always the easiest thing to do either.
Absolutely. Well, if you go to an urgent care, they should,
Yeah.
give it to you too, but,
I had to really convince my
Right.
doctor to send me for the test.
that
And
started,
then once you get the
That's-
test, and then they give
Then
you
they
the Western
go,
blots, then
But it could be like, you want to get it right away.
Yeah.
right.
And the test isn't always accurate.
There are certain providers around here, which is a whole other issue, that if you call them and tell you found a tick, they'll write a prescription. So it's
My
at
doc
the,
wrote
at
me
the
one
doctor.
right over the phone. but-
Exactly.
But they don't all, I'm just saying, I
Right.
hear it from a lot of
Because,
people.
and
Shower
this, practicing it
What
in
is
this
one or two
area.
doxy?
Somebody told me that's
How
the
does that
best
even
thing
work?
to do.
So it's just
I
an
shower in
antibiotic
hydraulic fluid
resistance.
daily.
It's
Actually,
a
that's
larger
used all over
scale
No,
thing.
but I'm saying if you're concerned that you may have it because you have a bite or you
Yeah.
find a tick, I don't know.
It might bother your stomach, but that's
Exactly,
worth
right.
the trade-off
You're
for
not on
many.
a full course of it, right? You give you. I
You
think
get
they give you
two,
2 pills.
just a package.
Yeah.
I've had 4 tick bites doses and I have to give them medicine.
It was in like a 2-week period.
Oh, yeah.
I had 4 ticks.
We have been in there so many
Well,
times.
32 of them, so far this right.
And they were like embedded.
All right, so we've run the course on the tick conversation. I'll only ask you to tell us about Norwegian scabies, and that's the
Oh,
last.
that's fun. That's a
Yeah.
fun one. So that was at a facility, unfortunately. It is a different form of scabies
Hey, guys, the director.
that, it just requires a different treatment. It requires the topical cream and, oral
Systemic, yeah,
antibiotic.
okay,
Everyone's doing fine.
okay, we don't have to worry about that.
But yeah, don't Google it.
Traveling with employees that work at different facilities and things like
Yeah,
that.
just don't Google it. Don't look at the pictures. Everyone's fine.
Did you cover the deaths from COVID?
She did. There weren't any.
None this month.
Okay.
There's 14 cases.
14 cases in June. We have very few entities reported to
14
us. I
cases
will
in
say.
January.
Yeah.
Yeah, hardly anybody would mention it.
Yeah.
Okay. All right, anything further for Director McGann?
Just one other question is about measles. I don't see anything about measles. Are we pretty okay this year for measles? Because measles are serious in a lot of places.
Yeah, no,
So
I
far,
hate
touch
to even
wood.
say it.
Right,
No,
okay.
My daughter's not vaccinated. I'm begging my doctor to vaccinate her at 6 months, but
But so far,
we'll
we've
see.
been.
Nothing yet,
Pretty good. Okay,
nothing
good.
yet. Nothing yet here.
Okay.
All right, thank you very much, Director.
Thank
We
you.
appreciate it.
Oh, and, our annual report that we brought to you last month.
Oh, that's great.
Are we okay to move that forward?
I'll move it.
Yeah, I'd ask for a motion to approve. I'll second it. Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you so much.
Really great work.
Thank you.
Next up, Office of the Aging, Director Benvenuto.
Norwegian Stevens sounds.
Exciting, right? Yeah.
We're hard at the ball.
Yeah. My only resolution this evening is for approval to contract with the Healthcare Consortium for our new H&HS program.
I'll move it.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
I don't know what you have in order here, so I just.
There's no real order. We're winging it.
I just saw lasagna, so what were we doing?
Yeah.
Beef, I saw beef casserole too.
Where did you see that? Was
There was a new menu.
Yeah,
I just saw lasagna.
Oh,
Yeah.
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 Jello, Jello.
Must be the next one down.
Yes, that is.
There you go.
Yeah, so ground beef casserole and lasagna with ground beef and sausage are two new menu items this month.
Wow.
Stay tuned.
When they serving that?
I think we actually just did
That
the
would
ground
be a
beef
takeaway.
casserole. Yeah, we could probably arrange that.
That's good.
Yeah, so we've been trying out some new menu items here and there with the new RDs and with Amanda in place. My go around of all the town boards is still kind of in progress. I just went to Claverick last Thursday, I think it was. And then I've got Hudson coming up next month.
How do we get
Community-
scheduled for that?
I'll probably schedule you, I'm on that list. I'll probably
You are
schedule
on
it
that
probably
list.
in September, maybe
Okay.
a little bit later in the year.
So what I have been doing. hold on,
And just so you know, it was wonderful. You did a great job.
Really, thank you.
Yeah, not really.
Yeah, why don't you pencil us in for,
September.
September?
Okay.
And
So
then I can-
my plan was, aside from Austerlitz, because he was yelling the loudest, and I mean that
That's
with
right.
the utmost.
I'll take it however
I
you
don't,
want to
that,
say
that doesn't surprise me.
it.
I figured I would go to home committee towns last because you hear from me the most, but I can absolutely stick anybody in anytime. The
Very
in progress-
informative. Talked for like an hour. It's great.
Yeah, you are gonna
That'll
have
give
to
me a
bring
couple
out the
months to
Bring
get the word
popcorn.
out there.
I
Bring
think-
popcorn.
I
I
can give you a
can't-
half an hour in October. Half an hour.
October. I will try to cut it down by then.
You could leave materials.
Yeah, oh yeah, I'll bring a ton, right? I brought a ton.
Yeah, it was great.
Other community events that we've got going on, our senior day, officially September 10th. Thank you all for making that official. Lots of details to come on that. We are partnering with DSS to collect, gifts. What would you, for the Edith Casey, stocking fund this year as kind of our guest of honor. Like last year we did the Humane Society. This year we're gonna do a little bit of the Edith Casey stocking fund and then hopefully also use our 50-50 raffle to provide some to the local veterans as well, to try and spread the wealth around.
Toys for teenagers are particularly hard.
High on the wish list. Yeah. We are
I
gonna.
want an iPhone 14. No,
Yeah,
iPhone
that's
16. Are we on 18 already?
We are
16,
gonna
I think.
put out an official wish list as it gets a little bit closer. We've got somewhere in the fold here, I've got Medicare 101, a nice beach themed flyer for you all to be aware of. We've got 3 sessions coming up, one in Hillsdale, North Chatham, and New Lebanon. Very exciting stuff, all Medicare questions. We've got also coming up, actually currently happening, our farmers market coupons are here. They came in late and many counties across the state got the wrong coupons. So it has been quite an interesting adventure. We thank the farmer's market gods got all of the correct ones, because can you imagine? Wow. So they are officially being distributed. We are in the works of putting together a Cooking with OFA video series. So stay tuned to see if that is a success. I feel like it could get really interesting. But our plan is to do the first one, taking items from a farmer's market that you can buy with those coupons to give you an idea of how to make something. I have, of course, been banned from the cooking process and can only be allowed to videotape. I don't know why. I'm so good at cooking everything. So we have a list here of all of the distribution locations that are sprinkled throughout the county. Please note that we will do home visits for people that are unable to get out to one of these spots or to our office. We've done them before. We will happily do them again. If someone who is homebound wants a the booklet, we have to go to them and have them sign off on it, but then they can designate someone to spend those farmers market coupons out at the market. So, and then on the back of that flyer, I just have some kind of basic information about the program for folks. And then we've got coming up July 23rd, Senator H&HS office reached out and were so kind to actually put together all of this event essentially for us and just asked us to support, spread the news, and then table and be a part of sharing resources and things like that. And when they said, "You're doing all the work," I said, "Great, sign me up." Because I panicked when they said they wanted to do it July 23rd and called me in June, because as you know, it takes a lot to put like something like this together. So I brought that flyer for everyone to see. There's going to be all sorts of vendors there. I think, I don't know if the health department or mental health or DSS have been approached, but I know that they've been talking to a lot of different vendors to get them there. So it should be, from what I picked up on this, I wasn't around for the Golden Gathering, but it sounds like kind of the stirrings of maybe that coming back into play, which I think will be exciting.
What is 3211 Church Street? Is that the town?
That is, yeah, the Felicia Village Hall.
Okay, that's right.
It's in that building. I believe it was originally scheduled to be in the gymnasium area, but the AC either doesn't exist or isn't super reliable. So if it's incredibly hot that day, it will be in one of the kind of meeting rooms in that building, but it'll be there with lots of signage. Same number of LAQ users. In August, we'll be at the Bank of Greene County Charitable Foundation Award Ceremony, which is where we'll officially get that next check. I know I'm bouncing out. I'm sorry, Kelly.
That's right.
We'll get that next check to replenish our home repair fund application. So that is very exciting. In the meantime, there is a state through NYSOPA and the Association on Aging. There is like a state home repair fund I'm working about, and they are working with, we have Lowe's here. Home Depot's across the river. I get them confused a lot. So we are one of the counties that's available to, because the program works directly with Lowe's. That's where they're getting all their materials. So I have one client that I've identified that I'm trying to get that program working with to get a lift installed, like a motorized lift to go up the stairs. But if there's people that you know of that need home repairs, whether you think we can do it or not, please don't hesitate to reach out and we'll see what we can do. I mean, I just went to the Taconic Senior Network 1-year anniversary on Saturday, which was, I never thought I'd say this. We played a lot of bingo and I had a great time. I really started to enjoy bingo. I didn't get it before, but now I get it.
With all the people standing.
Yeah, it's really intense, really
It is
intense. They go so fast.
Yeah.
But I think, that's kind of all I've got for you.
Yeah, don't ever say bingo if you don't really have it.
Oh, I know. I'm terrified.
Next thing you know, we'll be at the Chatham Fair. They'll be trying to drag Nina off the table, but she'll refuse.
Fighting people for bingo.
10 wins in a row, damn it.
I typically don't win. The one last thing I forgot to mention, we have now welcomed 2 new team members to the Team OFA. We have 2 new per diem drivers, Cian and Catherine, and we will be getting that van finally from that was hopefully aged and the Hudson River Bank Trust Foundation. So we're in the process of finally getting it. I'm so excited.
Nice.
Good things.
Sort of one question here was, I saw a flyer, and I'm not sure the source of its origin, about cooling centers. And we have a cooling center program, but we were not listed on the flyer, so I don't know how to get that updated and have our
We can
information.
certainly update that. Yeah, I think we took the information from health department.
This part of my silver application for our climate thing, so it was open about a month ago. It may not have been published, widely published yet.
For a particular demographic or just in general?
Anybody.
Did
But
anybody
Did I
show
get
up?
your
In
points for
our
that?
case, it is always seniors. It's
Did
not
anybody
but
show up?
seniors. For the 3 days that we were open, we only open if the temperatures are above 95. We had one person each day.
I never had any takers.
We didn't have any.
I think the word has to get out. When people start to hear it, they come.
And you report to Bubba too that you're doing it, so EMO.
He knows, yeah.
There's maybe he's the one that updates the like statewide website too.
I'll check and see, but
I don't know.
just would like to get if we're gonna distribute the flyer, I'd like to get the added publicity.
All right.
The UPS man was our polling center.
Yeah.
Somebody coming in. Any further questions for Director Benvenuto? Thank you very much.
Thank you very much.
Keep up the energy.
Yeah.
Saw that incredible. I'm glad you're listening to you.
Last but not least, Human Services.
I'm Kate, I'm covering for Dan. So he's got a few things on here. First one under financial authorization to modify the 2025 budget and contracts to accommodate 2025 targeted inflationary increases, as well as there was some unexpected grant money for an increase in grant money for county-run jail-based services.
Do I have a motion?
I'm over.
Do I have a second? Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, and then the other one is authorization to renew a consulting contract with Erica Wall, who's one of our psychiatric nurse practitioners.
Second.
Further discussion? All in favor? Opposed? Carried.
Authorization to contract with Beatrice Videz to provide trauma training to the staff in our fall staff development day.
I'll leave it.
Second. Further discussion? All in favor? Opposed? Carried.
And last but not least, authorization to reestablish a mental health clinic, a satellite clinic, school-based satellite clinic within New Lebanon School District.
Can I get it?
Yeah, I'll move it.
Can I just read the rest of that,
Yeah.
please?
It didn't come, that one didn't come through the New Lebanon one, right? That's Beatrice Vines. Vines or her Vines. Let's see. Erica Wall.
Can you refresh my memory how that's funded? Does the county pay for that? Is it a school pay between the school district?
No, good question. It's all billable services. So
Yeah.
basically, we are going to send one of my clinicians over from the children, adolescent, and family team over to New Lebanon. And, you know, in my meetings with New Lebanon had made it clear that like they have to be reimbursable services. We can't provide like meetings and, I mean, we can do that, but like in order for it to be successful financially, it has to be billable services.
And so are those reimbursements income based or is it just a flat fee?
No, it's based on insurance. So it would be like Medicaid, is probably gonna be the primary, insurer. I'm sure there will also be some commercial insurances that will see
Right.
through the school district as well, but so, you know, through the kids, the students.
Will you only go if you have potential appointments, or will you be there set hours per week?
We are currently looking at 1 day a week. They are also wanting us to split our time between the elementary building and then their middle school, high school is also one building. So right now we're starting with 1 day. We've already got approximately 15, maybe a handful more referrals from the school that included like parents signed releases and referrals. So we've already got, it's going well. Like I'm optimistic and hopeful that it'll be, you know, a little bit more viable than the last time. And New Lebanon seems to be very motivated to have us there and help the students. And they are, you know, we want to do this too. Like the kids are out and it's very difficult for a lot of the parents out there. Transportation was one of their major are, things that they cited to us as problematic in terms of getting the kids into Hudson at 325.
I remember when the New Lebanon supervisor and I met with the school district superintendent over his budget. New Lebanon had a disproportionately high number of kids that need these services
Absolutely.
and were unable to get to them because of transportation.
Agreed.
And I think they had transportation in their budget, and that's one of the things that fell when they went back to do the new budget. So
Yes.
Is
So
it one same, clinicians going, or is it a rotating?
one clinician has been identified.
Okay.
And then I think, we'll just see. I anticipate, we'll see what happens, but I do anticipate at this point in time that they might come back to us and want a second day.
Right.
And then we'll really have to kind of, think about, how to make that work, because we want to be able to provide that for them if possible. So,
Thank you.
And I
Yeah.
remember the other thing that came up in the budget conversation was the issue of the fact that there'd be a gap in treatment between the school year, between the spring and the fall session. So it would be nice to have treatment over the course of the summer. Is that being offered or no?
yes, my plan is to, as long as there's an administrator in the building, which is typically what happens in the summer, there's usually a principal there. I'd like to have Stephanie, that's the clinician who's going out there. I'd like to have her still out there for a day a week so that the parents would then have to get them to the school, but they wouldn't have to get them all the way into
Right.
325 Columbia. So,
And that works because their summer camp for kids is on the adjacent.
right,
They can walk back and forth.
right. The piece that might be a little bit tricky is, and we could always offer maybe telehealth, is those Christmas vacation or break weeks. There might not be an administrator there every day of those weeks. So that's going to probably be something we, talk in our next discussion with New Lebanon about, how do you want to handle that? But my plan is to provide that service through the summer
That's
for the
great.
continuity of care.
That's
Yeah,
really wonderful.
yeah,
Very good.
I agree. We're excited about it.
All right, any further questions for Kate? Or Ms. Sprague?
It's fine. That works.
All right, well, thank you so much
Thank
for
you.
joining
Thank
us.
you very much.
Appreciate it.
Is there anything from the committee? Is there anything from the public? There being none, I'm going to ask for a motion to adjourn.
So, second.
All in favor?
Aye.
Oh, carried. Wait a minute. Did I get a positive vote on that last resolution?
You didn't do all in favor. You had a
Yeah,
motion on
stay.
favor.
I'm going to rescind the motion to adjourn and ask for a vote on the final resolution.
Oh, did we have a motion in a second?
Yeah.
Yeah.
All in favor?
Aye.
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 Opposed? Carried. Now I'll ask for a motion to adjourn.
Second.
All in favor? Aye.
Still
Opposed?
12.
Thank you. Apologies for my little miss.
It's over.
Call the July public safety meeting to order, please. First one up is public defender.
Good evening, everyone.
Good evening.
I have two general resolution requests this evening. Help me out here, Kelly, if you would. I can't see without my.
Okay. This is to enter into the consultant
Yeah.
contract with Barker.
So I request authorization for the Cleveland County Public Defender's Office to enter into a consultant contract with Barbara A. Drabick. She is currently my administrative assistant. She's retiring at the end of the week. And this would allow her to assist in the training and the transition of her replacement.
Our experience has been that when we've done this, that these individuals are not used all that often, but who knows, we'll see.
Yeah,
Exactly.
That's paid for by the grant.
It is.
Move it. Second. All in favor? Opposed?
Kelly does not.
So,
Yeah, I
okay.
didn't hear right, sorry.
And then go like this. And then this next one is the funding, requesting authorization from the chairman to consent and sign the contract phase paid for the budget modification for the second statewide expansion of the Rel Herring grant to include a line.
Second. All in favor?
Aye.
Opposed? So carried.
Thank you very much.
Thank you.
Thank you.
Fire?
I'm here. Good afternoon.
Good afternoon.
So, let's see, what's up first? Appointment of deputies. Sean Hoffman from the city of Hudson and Mark Delphin from Stockport Fire District. They both applied and been through the interview process to become deputy coordinators for the county. I think there'll be a couple of real good assets to the office. So
How long of an appointment is it? Is it an annual?
2 years.
Yes.
They get appointed every time I get. Right?
And this is for the remainder of,
This is for the remainder of this year, and then if I get reappointed in January, then they'll come on.
I'll move it.
Second? All in favor?
Aye.
Opposed? So carried.
Thank you. Declaring the 1995 KME fire truck surplus. We got our new pickup and we're outfitting that. Time to get this thing out of the barn.
Second? All in favor?
Aye.
Thank you.
Opposed? So carried. Thank you.
The only other thing, was the, activity, which is self-explanatory. But the one thing I wanted to bring up that we're starting to discuss with, between the chairman and the, sheriff's office is now that it's budget time, we'd like to, try to get a chunk of some of the fire alarm law money that we're chasing around false alarms for all the while to help, subsidize some of the stuff at the training center for the fire departments. So we're starting that discussion now. So just so you guys are aware of it, that when you see it from budget time, that's what's happening.
We have one in New Lebanon that happens.
You know, we have quite a few all over, but it works out, truthfully, it works out when we look at the report from 2024 was the last one I looked at it. We're about, it's almost 50-50 as far as responding to alarms between the law enforcement stuff that goes to and the fire departments across the county. But they do a little more dispatch and a little more, you know, so we're not looking for all of it. We're just looking for a piece of it to try to help.
And the current policy is they get X number a year.
Right, the law says they get 3 a year and then they start getting fined. So there's a, you know, some people get fined pretty hefty. Plus there's local laws that they also get fined from.
And that's maybe to their
Yeah,
local.
We just passed.
Yeah, you just passed one, right? So not only the county is trying to get after it, but
And have we not been collecting?
Oh, yeah.
The fines?
yeah, it's just been going in the
You
sheriff's
just want some
department
of the
budget. I just want some of it for, and if we run out of money, that's a good thing. Then it's working the way it's supposed to.
And then when you do the town law, then you can give that to your town fire department. For responses.
All right, anything else?
Thank you.
Chairman,
Yes.
I'd just like to recognize Director Keeler for his continued support of local fire companies. I caught him out at H&HS Fire Company at their banquet over the weekend, so,
Barbecue this weekend at Tri Village.
yeah, I don't know what come up. Thank you, sir.
No, my brother.
Thank you. Thank you, Supervisor. Emergency management.
Sorry, wait, yo.
Mr. Harrison.
Afternoon, of course, we've submitted our activity report. If you had to answer any questions on that, and also been asked to give, clarify any questions on the hazard mitigation plan, the status of the plan. I know we spoke.
No, I appreciate that email, which outlined every bit of it.
Yeah.
We could, if anyone doesn't have it, we can get you that.
Where we are now, the plan draft is not, can't find it on any website or whatever. Our final draft was submitted by the Ty and Bond consulting firm around May 1st. We submitted that. The consulting firm submitted it on May 14th. New York State dishes, so it has to be approved from by first. Sent back revisions that had to be made. The consulting firm made the changes. They submitted another final draft on June 24th. Hopefully that is the final draft. But the reason why you can't find it anywhere is because it's in process. Any draft that you would see now would not be approved. So it's changed twice since the public review and comment period. It's already changed twice. It could change again if they come back. Once New York State approves it, then it goes to FEMA. As far as New York State's concerned, if it goes to FEMA, it should be approved. They just have to review and approve it because their intent is to make the information in line with what they require. So, process, if there is a FEMA.
But there is a misconception
Not
out
exactly
there
sure.
about FEMA funds that we are eligible
All right.
in
So,
the event of a
In
disaster.
the very beginning, there are specific grants that municipalities are not eligible for, like the brick grant and some of the other grants, unless you have an active approved hazard mitigation plan. Those haven't changed. We're not entitled to them. I don't know of many towns that have actually applied for them and been awarded them. But any disaster that we may have, that we're eligible for, the county has to, if we have a disaster now, a tornado that goes through county, we have to meet a threshold of, I believe it's upwards of $290,000. And then New York State has to meet a threshold of close to $40 million. So if we have a tornado in Columbia County, there's $5 million worth of damage, but no other county is affected, we're not gonna get FEMA money anyway. But if there's $40 million and maybe there's state facilities and state highways that are damaged or whatever, it's really not that much damage nowadays. Then the governor can request a presidential declaration of disaster, and that invokes FEMA. We're still entitled to any of that money that we would be eligible for. This doesn't affect that. So right now, we're waiting. I attached a letter that New York State Dishes had sent to us that they assured us that they will do whatever they can to expedite the review process. However, it could take several months on their behalf. FEMA, they say, will only take 45 days. That's not my experience. The last time we did it, FEMA took substantially longer than that. But, so we're really just waiting. I'll contact them and ask them to answer your questions on those submittals. They didn't go through us. They went right to Ty and Bond. When you talk to them, though, you have to understand that this really isn't our plan. Although it's our information, the information in this plan is what's required by FEMA. What's in it, how it's in it is hazard mitigation plan information that's required by them. And it's all good information, don't get me wrong. It has a lot of good information that can be used, but it's really to make us eligible for these grants.
My understanding is that in both cases, the Ty and Bond had been pretty good about curating what information they needed and what they didn't. But the submissions from the two towns that I was talking about, when the Ty and Bond issued the draft to towns to review, the most recent submissions for those towns were not in that draft.
So you would have to, I'm not saying that all the public comment and review stuff is in there, or the submissions that they asked for.
Yes, and what they
That was true for my town.
And what they were told by Ty and Bond is that they've gotten caught in their spam filter or in their trash filter and that they hadn't received them. So that it was Chatham and New London. Those are the two towns.
Have they corrected it now?
Well, that's what we're trying to find out. Did they get that information or not?
Right,
So we
so
can get the most
I will-
current version for our towns.
I'll ask them if you can get the most recent version of the sent,
The
or
town
if they can,
submission, only the town submission. We're not worried about the public.
or if they can answer any of your questions, they should do that.
Thank you.
And you should know that, so.
Well, it's like the person who prepared ours, if we can have the draft that was just submitted, resubmitted, he can just go to the 11th section and just make sure
I'll
that
do that, but
we sent, it's not
as
for
I
public.
said to this, because they're being made public, and
We will make it
you guys, I have no problem with you
We
guys
want to do an
having it.
internal review.
It's just.
Because if New Lebanon's changes weren't updated, then we need to actually submit a new version to New York State that has the correct information that we submitted. Not the
probably-
public, I'm talking about the town, our government, our town government said,
Oh.
you're incorrect on these data points for New Lebanon, here's the correct, and it didn't
It's some other,
incorporate
okay.
them.
Alright.
So,
For this plan specifically?
yeah,
Yes.
Alright, so you probably have to go through us anyway. I don't think you can do it directly for the hazard mitigation. Plan.
Yeah.
You're not gonna be able to do it directly with.
Yeah.
Them. They'll want you to go through us, which is fine,
And just,
but it has to be done before it's approved.
and we had a similar issue, but our corrections were noted. So I'm hoping that this is just an admin thing that we'll find that they were caught up.
I hope so, yeah.
Any other questions? Thank you, appreciate it. 911, Oh, yeah. Two personal resolutions. The first seeks permission to fill one full-time emergency dispatcher, one position. Move it.
Second.
All in favor?
Aye.
Opposed? So carried. The second seeks permission to fill one full-time emergency dispatcher position. Vacancy number 2025-100.
Second.
All in favor?
Aye.
Opposed? So carried. Both positions are budgeted and were approved on the July 2nd, 2025 meeting, point one committee. So thank you.
And then you just have to.
What do we got here? Full-time emergency dispatch, that's it. That's it, right? Any questions from the public? Anything from the committee? If not, I will entertain a motion to adjourn.
So moved.
Second?
Second.
All in favor?
Aye.
Opposed? So carried. Third.